Nancy, and good morning, everybody. I'm Jim Taylor from Hanover County. And first of all, great job, Nancy, and thanks to you for all of your service. I believe your term as president is coming to an end, and so we owe you a great deal of gratitude, and I hope that at some point we're able to express that appropriately to you. I have the pleasure of introducing our first presenter today, and Tony McDowell is here to provide to us an update on the latest and greatest from the Opioid Abatement Authority. Tony was appointed executive director of the authority on August 1st of last year. His duties include overall implementation of the authority's goals and objectives as determined by the board of directors and distributing opioid abatement funds in accordance with the Code of Virginia. He previously served as Deputy County Manager for Public Safety in Henrico County from 2018 to 2022. So he is one of us. He's a local person, and he played a leadership role in developing Henrico County's comprehensive strategy to prevent, treat, and support recovery from substance use disorders. He actually began his career in Henrico as a firefighter medic in 1997 and rose through the ranks to fire chief in 2012. He earned a bachelor's degree from Virginia Tech and a master's of public administration from the University of North Texas. So, ladies and gentlemen, I give to you Tony McDowell.
Thank you, Jim, and thank you, Nancy. I'll try to carry you guys through this as easily as possible. I'll try not to be long-winded. I do appreciate the comment that Jim said about me being one of us, one of you guys, and that's definitely true. I've tried to bring the perspective of local government to a statewide effort to distribute funds, and so hopefully we're building the right kind of relationship to create a successful method statewide to abate the opioid epidemic. I'm going to attempt to share my screen. You guys should, at the moment, be able to see a slide that says Overview of Opioid Abatement Authority. I see Katie Boyle nodding her head, so I guess that means that I've at least somewhat figured out the technology. All right, I'm gonna jump right into
Tony,
it.
Before you get started, if I could also add, I may have missed, I probably should have said this earlier, but we are going to be, I think Leslie is going to be monitoring the chat. And so if people have questions or comments, they can put them in the chat. And then at the end of it, Leslie will be the moderator for that. Thank you.
Just call me Vanna.
Oh. Okay.
Okay, so hopefully everybody has heard at least one presentation or seen one review of what's happening with the way Virginia is managing its opioid settlement funds. But if you haven't, or if it's been a little while, this chart hopefully provides a kind of a refresher. So every dollar that comes to Virginia, these settlements, is divided into one of three slices as demonstrated on the pie chart you see here. So 15% of those funds will go to the Commonwealth, to the state government, where those funds can be appropriated by the governor and the General Assembly through the normal state budget appropriation process for purposes to, they have to be earmarked for abatement purposes, but it follows the normal appropriation process. 30% of all of the opioid settlement funds go directly to Virginia's cities and counties. And we call that the direct distribution. And as you may recall from previous discussions, it's really up to each city and each county to properly manage the use of those funds. Those funds are not, the use of those funds is not monitored. Like there's nothing in the law that says the state government monitors how you use those funds. The cities and counties are really held to a judicial standard because these funds are coming to you as a result of a civil judgment. And the civil judgment binds both the settling companies and the cities and counties to the terms of the settlement agreement. So you have to follow each one of the settlement agreements, and each one's a little bit different. And so it's important to work with your counsel to understand what those differences are. And then 55% of any settlement funds that come to Virginia are placed in the state's opioid abatement fund, which is managed by the Opioid Abatement Authority. And then Opioid Abatement Authority is required by code to spend these funds as demonstrated on the little bar chart here to the right. So 15% of the 55% is reserved by the OAA for opioid-related purposes by cities and counties. This is basically your money. This money is reserved for you. It's your money. But in order to receive it, the cities and counties have to apply to the authority and basically explain what your intended use of the funds will be, how you'll measure the performance, and then agree to a set of terms and conditions that we have. Now, if you're willing to apply those same terms and conditions, statutory requirements that we have for these funds, if you apply those same, what we call the gold standard use that's required for these funds, if you'll apply those same standards for the money you're getting directly from the settling companies, then we'll increase your share here by 25%. We call that the voluntary gold standard incentive. And so hopefully you've heard about this at least once before. If not, I'm happy to try to explain it in a little more detail. A big chunk of the money that the OAA will give out in the form of financial assistance will go to partnerships that are formed, cooperative partnerships that are formed by multiple cities and or counties. And so in order for that to qualify, you have to have at least 2 cities or counties that are working together to apply for a cooperative regional project. And there's some more nuances to that, but basically the intent is to fund projects that cover basically regional efforts involving multiple jurisdictions. These funds are competitive. So if you decide to work with your neighboring jurisdictions to apply for one of these grants, you're going to be competing against other groups of cities and counties that are cooperating with each other around the state to put in applications. And then finally, 15% of our funds are available to our board to provide grants to state agencies. And I'm not going to get into that in a whole lot of detail because it's kind of a whole different discussion that I don't think pertains to this audience, but obviously happy to try to answer any questions you may have. You'll notice that 35% of our fund is unrestricted, and all that means is that our board can provide additional awards above the amounts that are listed on these top 3 boxes. And so this is, as an example, the incentive that I talked about is coming out of this unrestricted bucket. It's there to give our board some flexibility on how they administer these funds. But importantly, we can only provide funding to cities, counties, and state agencies. So if you have service providers in your community that you would like to work with, basically the money has to flow through the city or the county in order for the funds to go to that service provider. Okay, so we can't fund service providers directly. Community service boards cannot apply directly to the OAA. They have to do it through one of their partner cities or counties, or through a cooperating partnership of cities and counties. Before I move forward, anybody got a question on this slide that's going to cause a problem in us continuing on in the discussion? Either hit the raise your hand button or put something in the chat. I'd be happy to stop here and pause and try to answer it.
Tony, there's not anything in the chat, so I guess you can move on.
Perfect. So one of the questions that people ask is, what is abatement? And I've got some slides here to talk about that, but I'm going to toggle my screen and show you our website. This is the OAA website. If you just go to voaa.us, and there's a lot of good information on here, but if you go under the media tab to documents, these are various documents that explain some details about these settlements. And if you look under guidance, Exhibit E, this is the published uses of settlement of opioid remediation uses that are approved to the courts. And it's referred to nationwide as Exhibit E. And it includes the core strategies, which is just a couple pages. And then it gets into additional approved uses. So it's not a comprehensive document, but it's pretty comprehensive. And if you read it and you read the other settlement documents, then what you'll find is that abatement refers to any efforts that are designed to treat, prevent, reduce opioid use disorder or the misuse of opioids, or otherwise abate or remediate the opioid epidemic, which may include, and there's a bunch of details listed out here. And you'll note that it talks about not just opioid use disorder, but also any co-occurring substance use disorder or mental health conditions. And so really there's a broad umbrella here. The goal or the thought process is that this money is not supposed to be used to build new parks. It's not supposed to be used for construction of elementary schools, or other sort of local government budget holes to be plugged, but rather for efforts that help people with opioid use disorder and co-occurring conditions. And so we've had a lot of people ask questions, for example, about can these funds be used for crisis services? And generally speaking, the answer is yes, as long as one of the main goals of the effort that's being proposed is to help people with substance use disorders, and that you can demonstrate that with some of your performance measures, then yes, it doesn't have to be strictly 100% opioid use disorder, okay? But it can't be 100% not opioid use disorder either. And so, and particularly when it comes to these funds here that you're entitled to, we're probably not going to be as strict on these as what we're looking for in the competitive area, because where they're competitive, we're going to be looking to do the most possible good for people with opioid use disorder as we can. So it's for treatment, it's to support people in recovery, to provide connections to care. It's support efforts that include law enforcement efforts to divert people from the criminal justice system or to provide services to people who are justice involved, to include drug treatment recovery courts. Now, keep in mind that drug courts have to be approved through the state Supreme Court, but they're looking to approve recovery courts. And so providing the funding and then meeting the criteria that the Supreme Court has is a really good approach for using some of these local funds. Supporting efforts to address the needs of pregnant and nursing women. This is a real area of focus because there's a significant gap in services for this particular group of people. So that's an example of an abatement use that's allowed. Any efforts that discourage or prevent the misuse of opioids, and really prevention programs, particularly if they're focused at youth, they tend to be focused on preventing risky behaviors. And so generally speaking, if you have a prevention program that's trying to help kids avoid smoking, avoid drugs and alcohol, that's going to qualify because that's going to, the same efforts that prevent those types of behaviors will also prevent the misuse of opioids. So again, it doesn't have to be 100% pure opioid prevention programming. And then any efforts that prevent or reduce opioid deaths or other opioid-related harms, including detox services, would all qualify under the definition of abatement. And so these are some examples of things that we've heard from some cities and counties that they're working on: prevention programs in the schools, detox, naloxone training and distribution. So this is the Narcan, treatment services, including medication-assisted treatment, which includes in incarceration, local jails, regional jails. That's clearly a qualified use. Programs to divert people from jail or to support them during their reentry to the community. Anything that links people to recovery supports like housing, transportation, job training, employment, all of those would be considered abatement. And as I mentioned, behavioral health crisis programs, as long as you can demonstrate a clear connection and a priority as part of the behavioral crisis program of connecting people with substance use and opioid use disorder to care. Some examples of things that are not likely to qualify, I'm missing a slide here, I apologize, is basically if you want to provide additional patrol officers on the street, that's not going to qualify because that's more of an interdiction than an abatement effort. So you can't use this money to buy police cars or paddy wagons or to hire more patrol officers or drug investigators, that sort of thing. We're not philosophically opposed to those efforts, but those are not abatement efforts. And so these funds at the national level and state level are not intended for interdiction. Similarly, to provide salaries for routine emergency medical services, because again, that's not the core focus of that, is not necessarily opioid epidemic. It's more broad in terms of a traditional EMS function. So those would not qualify as abatement efforts. We've had that question come forward as well. All right, so let me talk a little bit about the pots of funding. We already discussed this briefly. I'm going to toggle the screen again back to our website. This is our homepage. If you go back to media documents and you click on where is it? Underneath the resources for cities and counties, the summary of opioid funds to Virginia cities and counties, or I'm sorry, to Virginia localities as of January 2023. And we're going to have to keep updating this as additional settlement funds come through. You'll see the title, and then as you go through, there's some disclaimers up front, some notes that explain it, and then we have every city and every county in the Commonwealth listed in the index, and because all this is public information, and we'll pick on. Let's pick on Hanover. I think they're on page 30. Getting closer, folks, getting closer. Here's Hanover County. And so hopefully you can see the text on this. Where's my zoom button? Here we go. So using Hanover as an example, we've listed the fiscal year. This first column is your direct distribution from the distributors. So McKesson, Cardinal Health, AmerisourceBergen. This was the big one. You've already gotten, you got these two payments here already. And then there's Johnson & Johnson. So Hanover they got one check back in July for $43,876. In September, they got another check for $46,111. And I think it was in October, Janssen made its balloon payment. And so Hanover got $175,650, and they should have just recently gotten a payment from Mallinckrodt. So all of these are your direct shares that I was talking about. And then the piece from the Opioid Abatement Authority that they're eligible to receive if they apply for it is this $100,508, and then the 25% incentive that they're eligible to receive if they follow our gold standard is listed here in the final column. And so you can see for this table, we only include these three settlements, but there are more settlements coming. You guys may have heard that each city and each county has been asked by the Attorney General's office to apologize. I got two screens and I'm trying to move everything around. Each city and each county has been asked now to decide whether they want to opt into the next 5 settlements. Walmart, Walgreens, CVS, Teva, and Allergan. And all of that's due back to the settlement administrator, to the Office of the Attorney General by April 18th with approval of your elected body. And so instead of having 3 columns on that chart, you're going to have something like 6 or 8 columns, and we might have to switch from portrait to landscape. I'm not sure what that's going to look like, but there's more money coming. And each time one of these settlements comes to Virginia, the amount that you're eligible to receive from the OAA is going to increase as well. So again, just to reiterate some points about the direct distributions that you get, they're coming directly to you from the settling companies. They don't flow through the state budget. Each one of the settlements has slightly different requirements on the restrictions and how they can be used. In general, most, if not all, the money have to be used for abatement, but you really have to talk to your counsel, to your attorneys, to understand where you fall in it. Because, as an example, under the distributor's settlement, which is the biggest one, the amount of money that you could potentially use for non-abatement purposes is different based on whether or not your locality had initiated its own litigation prior to joining in with the state. I'm here to tell you that this stuff gets really complicated. It's much easier to just follow the OAA's gold standard, because if you do that, you will meet or exceed all the requirements of all the settlements that we've received or that are in the pipeline.
Hey, Tony, I've got a question here that probably would be good to go here.
Sure.
Can federal grants that counties have be used for matching funds when applying for OAA funds? So they're asking, like, if federal grants can be used for the matching to match.
As long as we will allow it, as long as the federal grant will allow it. And so, in other words, if the federal grant that you're receiving requires that those funds be used for a particular purpose that you had already agreed to use them for, then if you use them to supplement a separate effort with the OAA, then that would probably be considered supplanting. So we would have to look at that on a case-by-case basis, but we don't have we don't have any objection to it. We just have to make sure that you're not making two different commitments with the same pot of money, if that makes sense.
Yeah. And there's one more question.
Okay.
Based on new settlements coming, I've heard that our money will double. Can you confirm also how much is the total amount OAA has for grants?
Sure. Well, I'll answer it this way. The Commonwealth of Virginia, so the entire pie, we expect that right now that amounts just over $500 million over 18 years from the settlements that have been approved that you guys have gotten a piece of already. We think that the total amount is likely to approximately double, which would mean that for localities, the amount that you see on your table, ballpark, I mean, can't guarantee it because these things are still being litigated. You can probably generally expect that those funds are going to double over the course of the settlements. And we think right now that the longest length of settlement is going to remain the distributors, which was an 18-year settlement. In other words, all the other ones that are pending, we think will be resulting in funds within that existing time frame. In fact, most of them are looking like will be more or less front-loaded. Walmart, for example, might provide their full amount all in one single payment upfront. But we don't know yet. That all of that's still being negotiated. Great questions. Okay, so I think we've kind of beat this horse. Again, cooperating partnerships are where you have at least two of the partnering cities or counties, and at least two of them have to be in the same DBHDS region. So if you're straddling a region and you want to partner with a locality that's on the other side of that DBHDS region, then one of you is going to have to find another partner from your region. I know that sounds a little confusing, but you could have, let's say, for example, you could have 5 localities partnering together and 3 of them are in one DBH region and 2 are in another, then you're good. But you have to have at least 2 of them in the same region. And at least one of those entities must serve as the fiscal agent. It's just too hard to have 2 different entities sharing fiscal agent duties. And the budget for these particular types of grants will approach $20 million a year in the first several years. And so there's a substantial amount of funding available to support these regional efforts. All right, some timelines that we're looking at. Your direct distributions, you've already received those, and there's more pending. The OAA distribution, that grant application is open right now. We're able to accept applications right now. That application period closes on May 5th. And then the normal application window going forward every year is going to be October 1st to April 1st. So if a locality needs more time to figure out what it wants to do, you don't have to apply during this first window. And you're not going to lose your money. We'll hold on to it for you. And you can request it in October when the next round opens up. Now, I will tell you, I'm not terribly surprised, but I'm a little surprised. We haven't received any local grant applications yet. And I think there's a couple reasons for that. I think in the grand scheme of things, this has all happened pretty quickly. And for many cities and counties, investing in these abatement efforts is going to require really creating some entirely new lines of business or expanding what you're doing now in a way that can be, take some effort to figure out the right way to do that. And so it just takes time. And we would rather that localities go through the process that goes like ready, aim, fire, instead of some other variation of that, because we want these funds to be used wisely. And I think that, there's some requirements of the application process that because we have to meet the statute, it's not a complicated application process, but it does take, a certain amount of effort to put the application together, including that we're looking for signatory authority from your local elected body for whoever's going to be signing and submitting the application, whether it's the city or county manager, county administrator, or if the signatory authority is given to a different member of the city or the county, the local elected body has to pass a resolution to that effect. And the reason we're doing that is because we can't get in the middle between I mean, we can't have a sheriff applying and a police chief applying from the same locality for competing grants. So we really want the locality to figure out what its priorities are. And then the cooperating partnership grants are also open right now, but those are for applications that'll be funded next fiscal year. And then that's kind of, I wanted to leave a bunch of time for Q&A. This is my contact information. And so with that, folks, I'll turn it over for questions, ideas, discussion.
Okay, if folks can use the chat and provide any questions you have, that would be great.
Good morning. This is James. It would probably take me a lot longer to type it.
Okay, that's fine.
Than just coming off the mic to ask the question directly. Tony, thanks for the presentation today. Very quickly, you mentioned about the authority of the county manager, county administrator approval. Isn't it true that for the cooperative grants, you would have to have board resolution by your elected officials versus the county administrator? Isn't it the county administrator can approve the local grants, but when you talk about the cooperative, you need the board resolution according to your template, right?
Well, we will for the not for all of the localities that are participating, because that would really be onerous. What we're looking for is the board approval of serving as the fiscal agent for the locality that's going to serve as a fiscal agent. And so that's the locality that's going to submit the application on behalf of the entire region. And then what we're looking for is some sort of an attachment to the application that shows what the agreement looks like between the localities. And it doesn't have to be a 100-page MOU. It basically just needs to be an agreement that says that the localities that are named on the agreement have agreed to work together to submit an application, that they've identified one particular jurisdiction to be the fiscal agent, and that they will agree to work out all the more specific details, like who's going to indemnify who and that kind of stuff if you're awarded the grant. We don't want you to have to go through all that in-depth, detailed legalese and then not get approved for the grant. So we're trying to make it as straightforward as we can.
Thank you for that clarity. So if Chesterfield is a physical agent, my other partner in another locality, they just have to have concurrence from their county administrator with signing that agreement, but not necessarily the board resolution from that particular city or county.
That's correct.
Thank you for that, Tony.
Okay, so Jim's got a question. Can any money now be used for administrative expenses? Has any guidance been provided on examples of indirect costs? I think so, but I can't find it.
Yes, let me try to find, I'm going to share my screen and go back to our website and see if I can't navigate you guys to where that guidance is. So if this is our website again, if you go to the grants portal under the, and I'm going to click on individual city or county grant applications. And we published a revision because this question came up and we had to really think about it. We wanted to be really clear on the answer. And so within this revision, we talk about, so the code says that we can't pay for indirect costs. It doesn't talk about administrative costs. And so we tried to create some better definitions of what is a direct cost, what is an indirect cost, and what is an administrative cost. So a direct cost, an indirect cost would be where a locality is allocating a percentage of time for something that's already existing or fully funded. So for example, let's say that you want your budget office, your existing budget office, to be able to get 1% of this grant off the top to pay for their troubles. Well, your budget office is already fully funded, so that would be an indirect cost, and so that's not allowed. It's actually supplanting an indirect cost. Also, if you had a sort of an arbitrary percentage that you said, we're going to have a indirect cost charge of 3% across the top, that's not allowed either. A direct cost has to be something that can be specifically identified as part of your proposed project that can be directly attributed to the project itself or to the project's measurable activities. And so it could include salaries, travel, equipment, supplies. You could have an employee that's managing the program as long as that person's, first of all, a new employee, all right, or working additional hours that weren't funded in the past, and their efforts are focused on the program that's approved. Okay, and so when we talk about jumping down to administrative costs, we've added this as a new definition. Administrative costs are new to the recipient, so new for your organization, for the purpose of government oversight and management of an abatement program, to include managing and monitoring of expenses, collecting data, and making reports. Those would all be considered allowable direct expenses. And so if you have hiring an employee, hiring a contractor, or increasing the hours of an existing like part-time employee, or increasing the hours of an existing contractor in order to meet the oversight and management needs of your new program, those would be allowable. But utilizing your abatement funds for current employees' cost would be supplanting and therefore not allowed. So hopefully that helps with answering the question.
All right, got you another question from Charlene. Is there a way to see what other city or departments are working on with this grant, so maybe we can partner with them?
Well, we intend to publish successful grant applications once we have them, but we're so new in the process that we don't have any to share with you. And so we've been doing a lot of outreach around the state to different cities and cities and counties, and asking them, like, do you need any help? Do you have an idea? What are you working on? And we're hearing some ideas, but we haven't seen anything in writing yet. And so I think this is where Virginia Association of Counties, Virginia Municipal League, your own individual relationships that you have with your colleagues in other jurisdictions can be very helpful. It's important to remember that your funding that you're eligible to receive directly from the OAA just for your county or for your city, that 15%, it's not competitive. Like, you have a set aside amount of money. So we would encourage cities and counties to help each other with this process. And keep in mind also that you don't have to apply for one of these competitive cooperative efforts. You can simply pool the funds that you already have between you and your neighboring jurisdictions to do a cooperative regional project that might not even get one of our cooperative regional grants.
Are there any other questions?
Hey, Leslie, this is Jim. I think maybe since we have a few minutes, if folks are willing to share maybe some of what they've been working on or are together, as a region. I'll say that in the Richmond region, we have been having some meetings to talk about what we might be interested in working on together. It looks like we are definitely going to be applying for a planning grant at a minimum, but I'm hoping that we might get some feedback. Sorry, we might be able to also apply for some specific project. So more to come on that. But I wanted to see if anybody else would be willing to share either ideas that they had or what they were working on with other partners.
So I'm Margaret Graham from the Loudoun Community Services Board, and I was very excited as you explained the new definition of sort of administrative costs, because to organize at the county level, we have lots of activities that are happening, but I think you said earlier, like, measure twice, cut once, have a real good strategy. So I wanted to add for this initiative a specific like project manager and an epidemiology position to make sure that our data and our strategies are always aligning. So that's sort of one of my local plans that we're discussing with respect to looking across the whole community. And then at the regional level, our various community services board execs in Alexandria, Arlington, Fairfax, Prince William, and Loudoun are having discussions about what do we need that can best address the issue, but that if any one of us operate it, we don't have enough volume for it to work. So we're looking at building facilities to address the issues that are presenting in our young people as separate from the issues that address in our older folks, and how do we get the best grant application in to fund that? Does that help?
Thanks, Margaret. Rebecca, did you want to share something?
Sure. Hi, I'm Rebecca Vinnard. I'm the Director of Social Services for James City County. And I joined late. I apologize. I had a county meeting. But a couple of things. One, in our locality, the money that we received directly from the settlement, I was able to get approved a new family services specialist position in child welfare that's going to be focused on pregnant moms and parenting moms and dads who have opioid issues. We've seen an increase in our referrals for substance exposed infants. And unfortunately, far too many of them ended up in foster care. And one of the, for those in the social services world, one of the limitations, which I agree with, for child protective services is that you actually have to have a baby in order to, make that an open case. But with this funding, because it's not tied to those state requirements, we're able to do some prevention. So if somebody is pregnant and it's their first child, we would be able to serve them, obviously it's voluntary, but we don't have to wait until we have, the hospitals calling us with the exposure. So that's one thing we were able to do. And I was very glad to be able to do for just the money we got for James City County. As a region, we're already planning to set up both a drug court and a behavioral court, specialty court docket for Williamsburg, James City County, and York-Pocosin, to where there would be one docket in one court and one docket in the other court, but it would be shared. And so there is funding, of course, from the state for some of those administrative costs, but it doesn't cover things like transportation, incentives, maybe paying for some programs, that, again, try and get individuals who have issues with addiction out of the criminal justice system if they don't need to be there and into treatment. So those are just some of the ideas that this kind of just helped us move along, with bringing those ideas to light. So very appreciative of that.
Thanks, Rebecca. Okay, we have Anita. Would you like to share some information?
Sure. Thank you very much for the presentation. I was just going to say, we got a first small tranche of some money from the Opioid Abatement Authority, and we're using it to expand our OBOT program, our office-based opioid addiction program. The interesting thing, it's good and bad, is, you can treat youth as young as 16 in OBOT, according to the federal regulations, but we've been having overdoses of kids 13, 14 years old. So I don't really know what's out there for that group because it's so young, and I think the medications have not been approved by the FDA for that age group. But the question I had was, and I know our regional group, like Margaret said, is working on a regional detox program. Can the funding be braided? Is it, like if we had OAA money and money from the State Department of Behavioral Health and other, that's all right. There's no restrictions about what it can be braided with.
Yes, it absolutely can. The only limitation is that under state code, there's no supplanting allowed. And so
Right.
You guys know how kind of complicated that can be. But
Yeah.
I would say that as long as you're not promising two different products with the same stream of money, then you're going to be good.
Right.
The other thing that I'll mention is that some of you may be receiving funds like from SAMHSA, like SOAR grant funds that are they come out of the discretionary bucket of the federal government. And you never know from one year to the next whether they're going to be continued. And so these are fragile funding sources. It makes it really hard to hire staff and to implement solid programming. We will consider allowing you to divert those SOAR funds into a different program and to replace them with opioid funds. We just need to have the ability to kind of review those on a case by case basis. But in general, if you're using SOAR funds or other discretionary funds and you have no way of knowing whether they're going to continue after the end of the federal fiscal year, we will work with you as best we can to allow you to switch over to these opioid funds. I think are quite a bit more stable right now. Because I know from my experience in Fairfax how hard it is it's hard enough to hire clinicians as it is, and you tell them it's a grant funded position and the funding's only there for 12 months, then, I mean, that kind of defeats the purpose.
So Dana, did you have a question?
No question. I was just going to share with our first amount of, pretty small, but we're looking at annual substance abuse training for PD, schools, and our group home, all of them together that we can do annually. And then PD does regular work with the schools. So I was interested in your direct cost piece. And then City of Falls Church, City of Fairfax, and Fairfax CSB are all looking at partnership for the future. And then I also want to meet with Arlington because we partner with them as well.
Great. No, that sounds great. You absolutely can use these funds to provide training to more or less anybody, including police officers, as long as it's training that's focused on substance use disorders, including if any of you provide CIT training for your law enforcement, that training and the staff time and the overtime and those sort of uses can, as long as you're not supplanting. In other words, if you're already funding it with your local budget, then you can expand it, but you can't replace your local funding for those purposes. It's also, it may be worth noting, I think a little pro tip is if you're using your funds for a purpose that is substance use disorder, but it also has to do with some other things. So for example, I had a jurisdiction that reached out to me yesterday, and they're interested in doing a community paramedicine program and funding it with this work or with these funds. And it's sort of, the answer is, well, how much of that community paramedicine program is focusing on people who had an overdose or who have substance use disorder? And, it might be really hard for us to approve that if the vast majority of those paramedics' time is going to be, working with people who have heart disease. But if you use the opportunity to also educate all of your customers about what to do if there's an overdose, how to use naloxone, that sort of thing, then it helps to attach the requirement that it be abatement related to the program. So hopefully that helps. If you got a program that's kind of on the fence, you're not sure if it really meets the definition, you can always add in, or you can always look to add in education and prevention to lots of different audiences.
That's a good tip, because I think it's always about like building the continuum, because I think that up in across Virginia, the addictions continuum is just not there, but also it's good to know that the education and training for the existing staff that we can utilize some of this funds, because that also helps with the continuum. All right, so
plus
we've got
just general education of the community to reduce stigma. If you look at that document that we talked about, Exhibit E, and you go through it, there's a lot of potential uses: research, planning, community awareness, destigmatizing. All of those things are listed in that Exhibit E.
All right, so Jim says, is Virginia OAA unique? Is Virginia leading the way? Of course we are, right? That's a yes. Or, okay, so what's your answer?
Well, we are in contact with, not every state has agreed to these settlements. I think 47 of them have. Most of those 47 have either developed or in the process of developing some sort of office to assist with the distribution of the funds. Most of them, it seems like, are component of the state attorney's general office, which is an interesting approach. That's not what Virginia is doing. We're an independent entity. Many other states have bolted it onto an existing state agency. So like the State Department of Social Services or that type of thing. So we're a little unique in that we're an independent entity. and that we operate without oversight. We don't operate with direct oversight from the administration or the General Assembly. We have an appointed board of directors, and so that, I think, is designed to keep some of the politics out of it, which I think also makes us a little bit unique. And the fact that we don't provide grants directly to private organizations also makes us unique. We're one of the only states I've seen that we only provide funding to established local governments and to state agencies. In a way, I like that because you can only imagine the number of vendors that come knocking on our door that want to sell their products, and instead now they're knocking on your door. So, but I think the intention there was to let local elected officials decide how they want to proceed, as opposed to funding organizations in your community that may or may not. I mean, I think who knows better than local officials whether or not a local organization is operating in an effective, honest, straightforward manner. And then the final piece that I think makes us a little bit different is that we're doing more to measure outcomes than most states. So most states just want to know how the money was spent. We want to know how it was spent and what your results were. And there's no desire to make this super complicated or bureaucratic, but we want to know how many people you serve. So for example, the one participant that talked about hiring another person in social services to work with moms, we'd like to know how many cases you were able to assist in that. So we can report that information back to the population of Virginia at large, to the General Assembly, and we can demonstrate that we're making good use of these funds. You can imagine, after Virginia's experience with the tobacco settlement, that there's a lot of skepticism out there that these funds are going to be used for improper purposes. And so we want to be able to demonstrate that that's not the case.
All right, so Rebecca has a question. For clarification, if this funding was used for training for the schools, would it be okay if it was about all the substances include opiates? There's so many issues with students and vaping.
Yes. I mean, if you had a program that was solely focused on preventing kids from drinking alcohol, and that's the only topic in the curriculum, then that would be hard for us to approve. But the evidence-based programs that are out there deal more with the underlying issues that cause kids to engage in risky behaviors, and that would be absolutely a qualified expense. If the goal is to reduce, kids don't usually start, well, hopefully, they don't start their first substance that they ever try being an opioid. I mean, I guess it's possible, but the evidence shows that there's a progression that involves vaping or tobacco and alcohol and marijuana and then opioids. And so I'm not an expert on this, but I'm sure some of you guys are. You know that you're preventing the risk-taking behaviors and not just one substance.
But you're saying, though, that it's got to be a new program, so it can't be a existing substance abuse program that's already funded in the school that you put this money to it. It's got to be something that you show that's new, right?
Right, because in a larger sense, whether it's prevention, treatment, recovery, anything that you've already got funded you can't replace that funding with OAA funds, because then you'd be in violation of the statute about supplanting.
Yeah, and sorry, Leslie, I'll come offline if that's okay, just real quick. I appreciate that, and we were just having this discussion yesterday in a group that I'm in about how schools are overwhelmed in trying to deal with the amount of vaping and the amount of kids that are using, because they don't have the capacity to even respond. So it certainly is not something that it's supplanting. It's something that we don't have because we have capacity issues to deal with that. So it just kind of got my wheels turning about, school resource officers or, some people who can kind of start those programs, because we just don't have the capacity for them with everything else that's going on. So no, it wouldn't be supplanting. It would be something that's new.
So are you like the phone a friend, where if there's a doubt, they can call for technical assistance, say, okay, Tony, I don't want to go to jail and I don't want money to be taken back? Do you give guidance like that when people reach out to you? Is that within your purview?
Absolutely. We're a mighty staff of 4 people, and we want to be as responsive as we can be. My guess is that the last week of the application period, it might be hard to get a hold of us, because we're expecting, 100 applications to get dumped all in one week.
Yeah.
But we will do everything we can to respond to your questions. We only opened our office in November. And so we're moving as quick as we can. We have a really strong goal. Our board wants to provide what we call a toolkit to cities and counties of examples of programs that are evidence-based and that qualify for these funds. And we're trying to wrap our brains around the best way to create that toolkit. There's, all of a sudden the opioid epidemic has got a lot of money attached to it, and money attracts all kinds of providers, and some have a great record and some are, maybe not so much. And so vetting that and doing it properly is going to take a little bit of time. And so we're going to ask for a little bit of patience as we build the toolkit, but we absolutely want to be able to do that. We also are working with the Department of Behavioral Health to develop a cooperative contract with a group of vendors, consultants that can provide technical assistance. And so the idea is to create a cooperative contract that cities and counties can purchase off without going through procurement, to onboard a consultant to help you with technical assistance on abatement programs. And you can use your opioid settlement funds for that purpose.
Are you going to be posting, like for instance, if somebody calls and they ask a question about, it's a clarification that maybe you don't have in your question and answers, are you going to be posting any of that? Because I know in other areas of work between county and state, when you can look on the website and say, oh, this county asked the same thing I was thinking. It's helpful. I didn't know if you could do that or not, or just where you're not getting the same question asked 53 times. And I didn't know if there would be availability to do that. Yes, we have a section of our website for Q&A that we've been updating as questions come in. And, I've grabbed a couple from this call that I'll write down. And when we do an update, I'll add those to it. And so I really would direct you and your staff to take some time to look at the website. We've got a ton of resources on there, and hopefully you can find the FAQs and that'll help. Okay. Well, I think we're coming to the end. Tony, thank you so much. This was very helpful. Obviously, it's a very complex, but it's exciting to have these resources to be able to deal with, some capacity issues that we needed to for a while. And really appreciate you spending your time with us today. Well, I appreciate the opportunity, and I'll just I'll put an offer out there. If any of you work for cities or counties and you plan to apply for a local grant between now and May 5th, and we can do anything at all to help you with that process, please reach out to me and let me know. We're looking to shepherd some localities through so that others have an example of what it can look like to be successful. And so I'll just put that offer out there, and we'll do whatever we can to assist you. All right, so Nancy, I'm turning it over to you.
Okay, thank you, and thank you again, Tony, for that great presentation. I have to say, we put out a couple of surveys, and several folks responded to those surveys that they wanted this information. So we appreciate that you were able to take your time and provide that information and be responsive to our membership